Chair, we're not quite at quorum. Just one moment, please.
All right, thank you.
Kelly, I just want to make sure you got me down. Gerardo Pena.
I do. Thank you.
Okay, no problem.
Looks like we have a quorum.
Chair, we do have quorum now.
Okay, thank you. Good afternoon. Welcome to the Regional Domestic Violence Council meeting. Let's call the meeting to order, and I'm going to ask Kelly to do the roll call now for those present.
Good afternoon, Chair and members of the committee. I will now do roll call. If you are here, please say yay to your name. Patricia Clark.
Here.
Celeste Adams.
Here.
Zach Altman.
Here.
Lupe Bandon.
Here.
Christine Ellis. Vice Chair Dolores Ernst.
Here.
Gary Friedel.
Here.
Laura Guild. Christine Hahn McDonald.
Here. Sorry.
Elizabeth Herbert.
Calling you, appearing on behalf of Elizabeth Herbert.
Thank you, Colin. Samantha Hinchy.
Here.
Mary Lynn Kasanick. Andrew Lefevre.
Here.
Rick Leyvas.
Here.
Rachel Mitchell. Amy Offenberg.
Here.
Gerardo Pena.
Here.
Bridget Peterson.
Here.
Chris Charlau.
Here.
Kelly Shore. Melissa Thomas. Brandon Wilson. Sarah Youngblood. And Chair Anita Norton.
Present.
Thank you.
Thank you. Little housekeeping. This meeting is being recorded and live streamed on the YouTube as a way for members of the public to participate. And do we have any other members of the public not identified? No. Okay. I will ask that you keep your microphones on mute when you are not speaking. For the purpose of the meeting minutes, I ask that you state your name before any comments. Before we begin the meeting, I'd like to especially welcome a new member of the council, Christine Hahn McDonald, with the City of Scottsdale, is now joining us. Ms. Hahn McDonald is replacing Scottsdale Vice Mayor Caputi in this role. We welcome you, Christine. Would you like to introduce yourself to the council?
There, thank you so much. Yeah, my name's Christy. I have worked with the City of Scottsdale for 22 years. I originally started in the area of senior services, where I spent much of my time doing case management and working with seniors in the community. I then moved on to Section 8 housing, also worked at the Paiute Neighborhood Center, where I ran the center there where we provided a variety of different services. And now I'm at Youth and Family Services, where we offer, I work with the court administration and dealing with a lot of our adult screenings, DV cases, anger management, shoplifting cases, and then we also have our restorative justice programs for the juveniles. So certainly come with a wealth of social services background, and really pleased that I get an opportunity to participate on this council. Thank you.
Thank you. It sounds like you have a lot of experience and will be a welcome addition, and we look forward to your participation.
Thank you.
For action items, we will be taking a roll call vote. I will ask staff to call out the council names and then ask how you vote. And if there are no questions, we'll move on to the next item. Call to the audience or to the public. Please note that members of the public were given an opportunity to submit written comments relating to this meeting to azmag.gov comment within 1 hour of the posted start time for the meeting. Kelly, has staff received any comments from the public?
Madam Chair, we have not.
Okay, thank you. Let's go on to item 3, approval of the October 7th, 2021 meeting minutes. Is there a motion to approve the meeting minutes?
Motion to approve.
Is
Luby
there a-
Bendine.
Loopy seconds, Loopy motion. Is there a second?
Second by Jerry Friedel.
Thank you, Jerry. Second by Jerry Friedel. All right. And then our first presentation is, I'd like to introduce Laura Gill with DES to offer an update on this important partnership to address abuse of older adults. This is through the U.S. Department of Justice, Office of Violence Against Women, Arizona Abuse in Later Life Grant. Laura, you have the floor.
Thank you. Thank you, Madam Chairman. And I want to say I just left a day-long meeting we're having with our partners right now, our federal partners, to give this presentation. I'm representing Jody Hecht, who is our program coordinator. And I'm going to give this to you, take questions, and then jump back to that other meeting. Okay?
Thank you.
Madam Chair, I hate to interrupt, but we had a motion and a second, but we never voted on that motion.
You're right. Okay, I'm sorry.
Hold a roll call vote for the minutes. My apologies. Thank you, Mayor Peterson.
Okay. All right, all in favor of approving the minutes, say aye. A roll call vote.
We'll do a roll call vote. I'll go back through the roll call. If you'll please say aye, if you approve the minutes, that would be wonderful. Celeste Adams,
Aye.
Zach Altman,
Aye.
Lupe Bandon,
Aye.
DC Ernst,
Aye.
Gary Friedel,
Aye.
Laura Gild,
Aye.
Christy Hahn McDonald,
Aye.
Elizabeth Herbert,
Aye.
Samantha Hinchy,
Aye.
Patricia Clark,
Aye.
Andrew Lefevre,
Aye.
Rick Leyvas,
Aye.
Chair Norton,
Aye.
Amy Offenberg,
Aye.
Gerardo Pena, Bridget Peterson,
Aye.
Chris Charlo, Kelly Shore, Melissa Thomas. Thank you, Madam Chair.
All right.
Gerardo
thank-
Pena is an aye. I apologize.
Okay, and back to you, Laura. Thank you.
Okay, thank you. So again, we've talked a couple of times about this grant, so hopefully some of you, this begins to sound familiar. But our project, our Arizona Abuse in Late Life Grant, we submitted the needs assessment, and I think I've talked to you about that several times over the last couple of meetings, was collected and submitted to the Department of Justice. Along with that was an outreach services strategic plan, OSSP document that was created as a result of the needs assessment and actually asked for how we could utilize funding in order to improve particularly our victim services. So we submitted that. Everything has to be approved by the federal government. And we asked for a modification to the original budget that was submitted, like a year and a half ago. We got approval on that. And so now that our budget has been approved, we're going to be able to release additional victim service dollars for aging into DES that will be used by the Area Agency on Aging. So that's really exciting. Part of what that funding is going to be used is to support a housing specialist position. One of the things that was identified most clearly in the needs assessment we did in April was that there was a need for more housing. And so we can't build houses, as you all know, or find housing, but what we determined would be helpful is a dedicated person to just focus on housing and try to help people find secure housing. So that's been approved, and Area Agency will be hiring that individual. We have a progress report that's due at the end of January to reflect all the work that we've done. We've hired, as you know, a new project coordinator, Jody Heck. We have a representative from MAG who's assisting us, Michelle Fulcher, under the guidance of Kelly Williams, is doing so much with the coordination, communication of the meeting. She is an asset, without a doubt. We did compile that we'll be reporting that we compiled the needs assessment and created the strategic plan. One of the exciting things is we're really starting to grow our community CCRT. We're adding more members from City of Phoenix, both fire department, thanks to DC, and the police department. We've got some detectives on board. So we're starting to expand it based on the kind of requirements of the systems requirements, such as law enforcement, prosecutors, and victim services. One of the things we were just talking about, this is kind of an FYI in the meeting today, was to be able to maybe bring in more law enforcement outside just Maricopa County Sheriff's Department and City of Phoenix. And through our DV Regional Council, I think you will be a resource for us to contact other police departments in the area under our council that could join the CCRT. One of the areas in other states that was identified is where law enforcement jurisdictions were not all talking the same language, didn't see victims of late life abuse in the same way, weren't considering the cases in the same way. That was creating a lot of gaps in services. So we'd like to focus on that and strengthen that. So that's where I said our DV Regional Council would be an excellent venue to start with on that way. We're having the NCAL kickoff right now as I speak. And we are waiting our next steps is to review the MAG vulnerable adult protocols that were developed through MAG Regional Council, and to start educating our group on these protocols and how we can utilize these and be aware of them. We're also looking at more collaboration between those that are already considered partners in the CCRT to do some education about what do you do in your work and how does that inform or how does that assist late life victims. So we want to start educating each other on what we do, and that will just strengthen the collaborations. And of course, we have every intention of expanding the members of our team to include other underserved communities, such as we really want a tribal representative. We want someone from the LGBTQ community to join us. We're just looking at different ways we can expand in a meaningful way those that are already on this team so that we can all start to coalesce to form a really strong unit to make the changes that we will be making over the next year or two. I think that is really brief, and I'm reading off of someone else's notes and then editing as I choose. So do you have any questions or comments? I fully anticipate that the next meeting we have, Jody Heck will be here as our program coordinator, and will be able to give you all the latest update.
Laura, I have a couple of questions for you. In regard to getting our local officers involved in the CCRT, who do we have them contact? If we go to them and talk to the chiefs, who do we have them contact to do that?
Well, since you're part of the DV Regional Council, I would recommend that they contact Kelly. And Kelly, you agree or disagree with this, please, as a first step. And then Kelly can communicate to the members of the CCRT. What do you think, Kelly? Sound good? Nodding. All right, that's it.
It does.
Okay.
Great. Thank you, Madam Chair and Laura.
Thank you. And then I have one more question. Is there in this grant and the program and the training, is there any kind of, in addition to the outreach and getting officers and the prosecutors and so forth involved, is there any kind of outreach to the community that we're looking at on this? And if there is, can you kind of describe some of that to us?
Yes, the answer is yes. A part of what we have in the budget is opportunities that we could use resources to increase outreach, create awareness that this is an issue. So those are to be developed, and what are the most effective ways of doing that will be items that we will develop moving forward. So there's definitely an intention of getting this message out. What does late life abuse mean? What are the resources that are there to assist, and what are the gaps in those resources? So yeah, that will very much be a part of it. I was just talking in the other meeting about if we could make a commitment in our CRT to continuously accessing the voice of the individuals that can be served through this. And that's broad community of anyone 50 and older. What are their ideas, their thoughts, their on services that are needed, areas that need to be improved. So that means an ongoing assessment, a survey of individuals. So we're always hearing the voice of those that are most aware of the issue.
So we could perhaps reach out to the senior centers in the various communities.
Yeah, well, that's certainly something we've already done through our surveying, but that would be continued. But if any member of the council wants to reach out to their local centers within their communities, make them aware of this. Again, any connections we can make back to our to the CCRT, make them aware. We could have them join our meetings. So there's a lot of opportunities more for growth and collaboration. And again, I think Kelly would be the first point of contact for that. Keep creating your work for you, Kelly. Sorry.
Well, I want to, this might be creating even more. I'm not sure if this is stretching it a little bit, but do we have those people in place that if we were to get a senior center to put aside a time where we could go in and have members from, whether it would be Doves or something, to basically give a presentation to them to, let them know what abuse in later life is like and what resources are available. Is that something that would be part of this agenda?
Yes, I keep creating work for other people that I won't be doing. So, but I know that is part of the work that does have been doing all along, because they've been institutionalized in terms of providing services to late life victims of domestic violence and other abuse. So I would think that they most definitely would be able to do that, and probably either in person or virtual, depending on what is the wisest way to move forward. So, and actually, normally Mary Lynn would be sitting here in our meeting because she's a member of our council. She's also in this other meeting right now. So I won't speak too much for her, but I would suspect that that's definitely a service that they could provide.
Great. Thank you, Laura. Thank you. We are committed to working with you and supporting these efforts, and we're proud to partner with you on this important work. Okay. Next we go.
Excuse me one second. Before Laura leaves, I just would like to point out that Laura is officially retiring from DES at the end of this month after more than 30 years of state service. And we would just like to thank her for all of the work she's done for the vulnerable of Arizona.
Thank you,
thanks.
Laura.
But I'm still hanging around,
I was just gonna
everybody.
say that.
No, I'm still
However,
there. I'm
right.
going to be part-time. I'm not disappearing, so.
Yeah,
So-
she's only semi-retiring. She is still going to be around to help all of us in many, many ways. So that's like the best news of everything. So
Especially if she keeps creating work for
Hopefully
everybody,
still
they're gonna keep
prepare.
her.
Yeah, right, exactly. I'll just say, well, someone else can do that now. And I'd like to still remain as part of the council, of course. too.
Oh, yes, absolutely. We thank you.
there
Okay,
you go.
thank you, guys. Have a good meeting.
All right, thank you.
Laura.
Bye.
Okay, and we'll go on to agenda item number 5. Andy Lefevre, Regional Domestic Violence Council member and the Executive Director for the Arizona Criminal Justice Commission, will now share information about the Arizona Peace Officer Standards and Training Board, AZ Post. We are thankful to Mr. Lefevre and the team for their efforts. Andy, the floor is yours.
Thank you, Madam Chair. So there's so many acronyms that float around that it's actually the AZ Point system, which is what is up on your screens. I was a member of the AZ Post board for a while, so one of the reasons why there may have been some confusion, but I'm going to give an update on AZ Point, which if I could get the next slide, please, Kelly. I think there you go. So this is something we've talked about a couple of times throughout the last few years here at the Domestic Violence Council. So AZ Point was a new system that we worked on, the Arizona Protective Order Initiation and Notification Tool that ACJC kind of spearheaded the process of meeting with and talking with stakeholders all around the state to understand how the old system worked, where we could find ways to improve that system, and ultimately then working with our legislature to introduce a bill so that we could put a pretty new system in place. And that system came online in 2020. Next slide, if I could. Or am I controlling, or are you controlling, Kelly? I'll drive if you need me to.
We're happy to advance the slides for you.
Okay, thank you. Again, let's just a quick recap on how the old system worked here in Arizona. It was a very paper-based system. If a person went into the courts and filled out all this paperwork and the judge granted them the order, the judge handed them back a paper order, and then it was dependent upon that plaintiff to try and figure out how to navigate the system, how to determine which was the appropriate law enforcement agency to get a hold of to try and serve the order. And then because of the very nature of that interaction between a plaintiff and law enforcement and trying to track somebody down, and then once somebody was served and getting that information into the process, there was a lot of delays built into the system that caused, quite frankly, especially somebody in a domestic violence situation, an increased risk between the time the judge granted the order and the order was enforceable. So next slide, please. So just to give you some ideas of kind of what the numbers and the data look like from the old system, on average, there were about 42,000 orders of protection or injunctions that a judge had ordered each year. Only about 51% of those were ever served at that point. And that's for a lot of reasons. They may not have been able to find the person they were trying to serve. Under the old system, it was dependent upon the plaintiff to decide when and if they wanted the order to be served after the judge granted it. So quite oftentimes somebody would hold on to that for a period of time and then maybe decide they didn't want it served at the end of the day. And again, the delay that was built into that system, we found that when you looked at the information, it was taking an average of about 23 days from the time a judge granted an order of protection until it was served on the respondent. And then for law enforcement to enter that into the National Crime Information Center database, which is what allows law enforcement to see that an order had been granted and served. So that was 13 days from the time that a judge granted the order until law enforcement served it. And then another 10 days on average from the time it took for law enforcement to get that order to the sheriff and for the sheriff to enter it into NCIC. So almost a month where a domestic violence person would have kind of this window of uncertainty that they sought protection and perhaps they weren't sure if it had actually been enforceable at that point. Okay, next slide, please, Kelly. So we put this process together to create a new system. Again, it was the first time in about 30 years that we had actively reviewed and tried to update Arizona's orders of protection system. And we went in there with kind of three main goals. We wanted to improve public safety, obviously, but we wanted to increase access to the system for our public, and we wanted to obviously improve efficiency for that. So we wanted to do that by automating the process as best that we could, so that we took it from a paper-based process to something that was much more electronic. And we were hoping to increase the number of orders that were actually served that were granted, and the amount of information or the number of orders that could get into the system. So for those that may not be familiar, AZ Point is actually a portal that the courts host that has three separate parts. There's a plaintiff portal, so somebody who wants to actually interact and seek an order of protection can go into that system from anywhere on a phone or a tablet or a computer. They can start a process of entering all of the information into the system that they need to. Once they feel that they've completed it to the best of their ability, they can submit it through the portal. They get a tracking number. That information remains in the system for a period of time. When they're ready, then they can go to any court around Arizona, and the judge that's determined to hear orders that day can use that tracking number to pull all that information down, review it, decide if they're going to grant the order or not. When the judge does grant the order, now he pushes a button, and because of the information that's entered into the system determines who the most appropriate agency is to serve the order, and it's electronically transmitted automatically to that agency. They can pull that information down out of their portal. They have a law enforcement portal that's part of it. It says you have an order ready to be served. They can determine, yes, we are the most appropriate agency, or maybe we need to transfer it to a different agency, but they get that information that same day, and oftentimes they're served that same day. It becomes available. Once they do serve the order on the person, the officer typically returns to their vehicle. They can log back into AZ Point on their portal. They click submitted, and that information is then automatically submitted through the courts, through DPS to the NCIC system. So we look for ways to automate that process to really cut down on those people inefficiencies that were baked into the old system. So the next slide, please, Kelly. So again, it came online in January of 2020. We had some large system implementation hiccups that we had to work through for the first 6 to 9 months, but we pulled this data as of October of this year. And just to give you an idea of the improvements that we're already seeing in the process. So the number or the percentage of orders that are actually being served once they're granted by a judge has gone up from 51% to 67% over that 18-month period. And of the orders that are issued by a court, 70% of those orders are now served and enforceable. They're enforceable as soon as they're served. They're served and in the NCIC system within 7 days. And vast majority of those are actually within 3 days. So we've cut down tremendously from that 23-day period down to 7 days. And as you see, the data we're hoping will continue to go up. So it was 70% in 2020 and 73% in 2021. So we're hoping that with more training and more awareness of the AZ Point system and how folks will utilize it, that we'll continue to see those numbers or those percentages to go up. And I think I didn't have this data point when I was putting this together, but I think about 63% of folks that are now trying to get an order through the courts are utilizing the AZ Point system in 2021. So again, we've moved away from somebody physically having to go into courts and fill out papers to this ability to be able to do it, safely at home or at an advocate's office or wherever it might be, have that information be available, and then go into a court. So again, the system came online literally 3 months before the pandemic hit. So that was also a huge benefit to our citizens to be able to interact with the courts in a way that didn't require them to be in person quite often, or to cut a lot of that in-person time out of there. I think that's the last kind of just data slide. I wanted to keep it really high level. Obviously, we're going to start doing some deeper dives into the data to see if there are specific court jurisdictions that maybe are not as high of use of percentage, or is that a training issue that we need to address, or maybe a technology issue that we need to try and address in some of our places that maybe don't have as much technology available to them. But this was a large lift for our partners at the Administrative Office of the Courts and at Department of Public Safety. We don't own any of the systems at ACJC. We just, as I like to say, like to deconstruct things and try and figure out how to make them better, and then usually find money to do that. So I would be remiss if I didn't thank all of the many, many hours of hard work that were done by the AZ Point implementation team at both the courts and at DPS. I'm not aware, and there may be one or two states, there are a number of states that have electronic processes, but I'm not aware of any states, or if there are, only a handful, that have kind of integrated this flow of information the way that we've done it here in Arizona, so that it flows seamlessly from a plaintiff to the courts to law enforcement to the feds the way this one does. So we're excited about getting out and talking more about the success of this program to our colleagues around the nation, because we really do feel like this is, if not the best, one of the leading kind of systems that have been built across the nation at this point. And with that, Madam Chair, I'm happy to try and take questions. I may not know the answer, but I'll be happy to try and get the answer and get back to everybody. Oh, I think you're still muted, ma'am.
Thank you, Andy. Members of the committee, do you have any questions for Andy on this?
This is DC first. Do you know if you have done any surveys of the, I believe you call them plaintiffs, the victims, to see how they feel about this? I know that when this first started coming out, there were some concerns in the community about the advocacy community about the victims not having the power to have the petitions served, so that they knew when the offender would be served. I was just wondering if there's any feedback on that. DC, we worked really closely with the advocacy community as we were going through that stakeholder process, and I believe that part of the system that they sign up for is to be able to receive notification when it is served. So I think they would get an email or a text or something through the portal saying your order has been served, or it's been so many days and it hasn't been served. I'm about 95% sure that they have that kind of communication tool built in to the system to make sure that the folks that were seeking the protection know when it's been served.
Andy, I have a question. Do all of the law enforcement communities within the area, are they all aware of AZ Point? Are all of our victim advocates aware of its existence?
Yeah, Madam Chair, that they should be. Any law enforcement agency that would serve an order should have somebody or some buddies within their agency that are assigned to the AZ Point system to be able to add folks to be able to get into the law enforcement portal. Again, we worked very closely with the coalitions and stuff that we knew of at that point. We have plenty of informational cards, business cards, pamphlets. If there are folks that feel like maybe somebody does not know or would like information to be able to hand out, we certainly have that, and they can contact me and we can put a packet together and get it out to you all to hand out in the community. But I hope so at this point. But we certainly are always out looking for opportunities to talk about the system and what it means for our folks that are seeking those protections.
Okay, so I have another question. If there's someone in the community and they don't go through the victim advocate with our police department, but just on their own seek to get this order through the AZ Point system, how do they go about that? What's the website, or how do they know?
Yeah, it is, I believe, just AZ. If they look up AZ Point, it should take them to a landing page at the courts, but I'll double check that. We built the system, the interface, to be, I hate using tax analogy, but to be very much like a QuickBooks or a TurboTax. That's a better analogy. So there are all kinds of pop-ups that come up if somebody has a question about what does this mean or what kind of information should I answer, it should be pretty intuitive for folks to work through that process. Again, they can save it and come back later. There's actually a safety button on in the system. So if you are at home and you're filling it out and the person comes home that you're feeling threatened by or fearful of, you can hit the escape button. It'll take you out to like a cooking web page or something so that you can get out of it pretty quickly. It'll automatically save the information for you. So I'll find that website information for you, Madam Chair, and I'll make sure that I send that to Kelly so that you can have that. But I know it's on the AOC or the Supreme Court's website.
All right, thank you. And do they have a version in Spanish?
I believe that the information is available in both English and Spanish on the website. I think you click a button and it switches between the two.
Okay, great. Thank you very much. Any other comments or questions? All right, thank you very much.
Oh, I think I do see a hand up, ma'am.
Okay.
Yeah, hi, this is Tricia, and I just wanted to say that I had to, I'm not saying this is Chrysalis, I'm saying this is a community member right now. I had to go through AZ Point with a friend for her, and it was seamless. And it was very hard for me to step out of my role, but she did it. And it was seamless for her in getting it served and going to the court system. And so, you know, I mean, I've been involved in this for a very long time indirectly, but to see it work in real life, in real time, just congratulations and kudos to your department.
I will definitely pass those along. I just get to talk about it. I get to be bask in the accolades of all the good work that other folks have done, but I certainly will pass that along to the team, and you know, we certainly would appreciate any stories or things like that, knowing about that, so that we can let them know that, you know, the hours of work that they put into this are really making a difference in people's lives. So
It did for my friend. So thank you.
Well, thank you, ma'am.
That's good. That's good to know. Thank you so much, Andy. All right. If we have no further questions or comments, really good presentation, very good information. And I think it's something that we can all hopefully share with others to help or stem the tide of this domestic violence and get the orders of protection out for the people that need it. Let's go on to agenda item number 6. And with this is going to be committee's areas of focus planning, and DC and Kelly have the floor.
Madam Chair. So as we look forward to planning for the 2022 Domestic Violence Council, I was thinking about a recent conversation I had in my role as the program manager for the Community Assistance Program with Phoenix Fire. We recently had a conversation with Maricopa community colleges regarding trying to develop a program that would help us with our workforce. Specifically, there's a program through Glendale Community College and the other colleges on resiliency for first responders. And I was thinking of maybe we as a committee want to look at, considering all the workforce issues that are out there, looking at communicating with our community colleges to see if there's a way we could develop, or if they have programs that we could send people to get the education that they would need to become advocates, work in shelters. I'm also interested in how they could help people with lived experience who would be interested in getting into this field, getting degrees or life experience that would, or work experience that would make them eligible for positions in different programs. So that is what I'm putting forth to the council to see if anybody wants to discuss this further. I'm opening it up for discussion if that's okay with Madam Chair, and I'll stop talking.
Yes, thank you, Vice Chair DC. Any discussion on this? Thoughts, input?
Kelly, I had asked you to step in if I forgot anything. Is there anything I failed to mention?
Thank you, DC. Madam Chair, I just wanted to echo DC's input on this. We have heard from several members and also members of the community asking about actions that the council takes. And so we thought it would be helpful to be able to propose some very specific actions that the council could work on for 2022, including supporting workforce across the region, fully recognizing that if any of you have ever had to, for example, try to make a therapy appointment, you know that even with private health insurance, with great health insurance, the wait times can be 3 to 9 months because the workforce is just not in place. And unfortunately, we are also seeing those workforce issues both in crisis work and also across the DV continuum. So anything we could do to help try to support not only providing opportunity for students who are interested in this work via internships and other opportunities, supporting educational platforms that are already out there through our community college and college systems, and having continued conversations about what supporting the workforce for both crisis and domestic violence positions in the future might look like. I see there is a hand raised, Madam Chair.
Yes, Kristen.
Thank you. Kristen Charlo from City of Tempe, Care 7 program. I think this is an absolutely fantastic idea. We are just getting ready to open our Family Advocacy Center. So yes, thank you. It only took 20 plus years, but we are there. We are in final lease negotiations. And I have to say that really fully developing our workforce is becoming quite an issue. We are all looking for advocates. We are all begging for therapists. And you and me both, sister. And I think that we have got to start following a model that has been advanced by our federal government, which is to use concentric circles of professionals. So we've got to take, the highest level professional, put them in the middle. And then we have to start taking levels of professionals with utilizing paraprofessionals and peer to meet these demands, unfortunately, that we have for both domestic violence and sexual assault. And so we're looking to develop that model at our FAC and within our mental health response program as well, finding folks who have both the lived experience and the education to provide that type of really unique support that victims can relate to. I know that 2 of the individuals that the licensed master's level social workers that I have at Care 7 are also veterans. Their ability to connect with the veteran population is almost unbelievable. And so I believe that we've got to start, we recently had a conversation with the county attorney's office about forensic nurse examiners, or the lack thereof, to do the sex assault exams. And it's dire. I don't know how many of you know all the details, but there is a dire need for these folks. And I don't know how we're going to foot the bill. I feel like what we need to do is start going to high schools and finding students who are interested and helping them on the path to this career choice, because we all know that it's hard work and we need individuals. I was at a wedding recently over the weekend, and there was a nurse at the wedding, and I said, so have you ever thought about being, a sane nurse? I feel like that's kind of the point we're at. So I love this idea. I think that many of the victims that we serve would be absolutely thrilled to have this type of opportunity. So tell me what I need to do to help move this forward.
And more weddings and recruit at every wedding you go to.
All right. And we also have a hand from Sam. Sam, would you like to please comment?
Yeah, I just was, hold on, let me put my hand down. So weird. I just was curious, I guess that this is in like the very beginning stages, because I'm just curious, like, what does this look like? Are you thinking like a 2-year course? Is this like an addition to something? So like at ASU, they have part of their social work. They have a DV certificate that you can get. So these students take classes that are specific for DV and get a DV certificate when you graduate. Anyone can get it. It doesn't have to be social work, but that's where it's housed, in the Office of Gender-Based Violence. And so I'm just curious, like, is that like, do community colleges have certificates that you can get on top of what you're doing? I'm here for it too. I'm just really curious, like, what, I don't know. I would be interested in having more conversations about this, I guess.
Madam Chair and members of the committee, a few things that we discussed just as beginning topics would be to have at least one speaker at each meeting for 2022 focused on workforce, so we can all better understand what the gaps are and where we could be better supporting what current programs and certificates and other opportunities are available, including how to develop internships if you don't have an internship program currently, how to support students who are looking to plug in. What are the holes in workforce at the moment? How do we encourage high school students to pursue this level of education? How do we support mid-career individuals who might be interested in going back for a certificate program like you just described? So I think the actionable item here would be a commitment from the council to support at least one speaker per meeting moving forward for 2022 with actionable items on how we could improve and expand the workforce specifically for domestic violence and crisis.
All right, thank you. Are there any other questions or comments? Okay, do we have a motion for how we should move forward in 2022 in this regard?
Can I move my own item?
I don't see why not.
Awesome. I would move that in our 22 meetings that we attempt to have a speaker at all of our meetings to move this forward, to look at workforce and how we can increase the workforce for domestic violence and crisis intervention.
Okay, and do I have a second?
Patricia Clark, I second.
Okay, we have a second by Tricia Clark. And shall we have a roll call vote?
Yes, Madam Chair. Celeste Adams.
Yay.
Zach Altman.
Yay.
Lupe Abandon.
Yay.
Vice Chair Ernst.
Yay.
Gary Friedel.
Yay.
Laura Gild.
Yay.
Christy Hahn McDonald.
Yay.
Elizabeth Herbert.
Yay.
Samantha Hinchy.
Yay.
Patricia Clark.
Yay.
Andrew Lefevre.
I think I may abstain. No, yay, I'm just kidding, yay.
Rick Leyvas. Rachel Mitchell. Amy Offenberg.
Yay.
Gerardo Pena.
Yay.
Mayor Peterson.
Yay.
Chris Charlam.
Yay.
Kelly Shore. Melissa Thomas. And Chair, how do you vote?
Yay.
Thank you.
Okay, thank you. And we will go on now to agenda item 7. And this would be request for future agenda items or topics of interest to the council in addition to what we just voted on.
Madam Chair, this is DC again. So I received a notice, I think earlier this week, about a New Life Center merging with Katie's Way. And I would move that we ask someone from New Life Center to come and talk a little bit more about that merger and their work.
That's a great idea. And I think that's something that we definitely can put on the agenda. I'm familiar with Katie's Way, and so real good information there, especially for younger people. Any other? Okay, we'll now go on to agenda item 8, comments from the council. Members are provided an opportunity to share information and updates for information. This item is for information only. Any action proposed will be slated for a future meeting. Any comments from the council? Okay, and I think at this time, Kelly, is this a time good for you that you had some things you wanted to present or no?
Madam Chair, everything has been presented on our end. Thank you.
Okay, very good. All right, hearing none, we will adjourn. And thank you for attending today. This meeting is now adjourned. Stay tuned for more details about our press event. Oh, I think we have some more information coming up later about the press event that we had. And thank you very much. Have a wonderful